Only 17% of patients in the hospital survive to discharge if they suffer cardiac arrest.
Learning to, like you said, let your team flourish. You've hired them for a reason, so you got to let them do the job.
That I felt it was so important that the students got this hour lecture, and I gave it probably to over 10,000 students. So how you grow and develop the team around you. I believe in the abundance mentality. You can't lead from up here. It's got to be eye to eye.
Ready to shatter the status quo and unleash your leadership potential? Sick of the same old tired leadership advice? Well, get ready to disrupt your thinking and transform your leadership skills. Welcome to Sound Leadership with DJ, the podcast that's about to challenge everything you thought you knew about leadership. Join DJ as he dives into the trenches with industry trailblazers, exploring the real issues leaders face today. From innovative strategies to proven techniques, we'll uncover the secrets to taking your leadership from good to great. Get ready to be inspired, challenged, and equipped to conquer new heights. Join the movement and let's redefine leadership together. This is Sound Leadership with DJ. Leadership redefined.
Welcome to Sound Leadership with DJ, the podcast dedicated to exploring the essence of leadership. We're all about connecting you with visionary thinkers and trailblazers who have reshaped the landscape of leadership. Every episode is a new adventure where we walk side by side with leaders who have achieved remarkable success. We'll trace their journey from their humble beginnings in leadership to uncovering the challenges they faced and the wisdom they've gained along the way. In this episode, I am thrilled to bring to you the patient safety expert. Let me say that again. The patient safety expert, Dr. Julie Siemers, CEO and founder of Dr. Julie Siemers LLC. She brings a wealth of experience with over 4 decades in nursing, including 15 years in nursing education leadership. Her last role as an executive director of a large university, she oversaw 2,700 students and over 300 employees. That's amazing. Let's repeat that again. This CEO, this nursing trailblazer, was the executive director of a large university where she oversaw 2,700 students and 300 employees. Talk about leadership. Today, she'll discuss the crucial topic of leadership in healthcare, focusing on patient safety and the importance of inspiring others to follow. This conversation is sure to be insightful and inspiring, and one that you won't want to miss. So sit down with me as I talk candidly to CEOs, entrepreneurs, community influencers, and other leading predominant figures as they share their stories, strategies, and pivotal moments defining their leadership journey. So whether you're refining your leadership skills or just starting out on your career path, Sound Leadership with DJ promising enriching content tailored just for you. I want you to stay connected and engaged. I want you to follow us on our LinkedIn and YouTube at Sound Leadership with DJ. On our LinkedIn and YouTube, we share behind-the-scenes content of how we shoot episodes just like this. But if you're mobile and you need it portable, you can follow us on your favorite podcast app. That includes Alexa, iHeart, Amazon, so much more. Simply search Sound Leadership with DJ, hit that subscribe button, and you'll never miss a beat. Now it's time to be prepared to embark on this inspirational journey of empowerment and transformation. This is Sound Leadership with DJ. Welcome, Dr. Siemers. How are you doing today?
Thank you so much. I'm really happy to be here.
I am happy to have you on this podcast. I know that you are all over the world doing what you do best, which is saving patients' lives, educating nurses to save patient lives. But you've taken time out of your day to speak with me. So thank you so much for taking time out of your day to speak with me. As I always start off with, I did that introduction, but that's my version. That's not your story. So tell us who you really are.
Yeah, like you said, over 4 decades. It's been a long journey and a really, really fulfilling journey, something I really didn't expect when I started the profession. I knew I wanted to help patients, but it has been just so rewarding every step of the way in every different job that I've had in clinical practice, and then 10 years on the helicopter, and like you said, 15 years in education. So each step has been an unfolding of something I learned about myself And then I could share with others as I grew into the role of leadership or as a now nursing leader. So thank you.
You know what? I didn't say that, but you said it. Helicopter. Talk to us about that, because that's you're not just gonna gloss over the fact that you was a flight nurse, right? Tell us about
Yeah.
that.
It was the most fun job I had. And part of that was because I'd had a lot of experience in the ICU, the trauma department, and the ER. But on the helicopter, it's just you and the paramedic and, of course, the pilot. And so we had protocols that we worked off of. But by that point in my career, I wanted to be able to make decisions that would impact the patient surviving the flight to the trauma center or whatever. And so it was really empowering to know that the experience I had learned in all those years really was put to the test, in that environment. But yeah, I did that for about 10 years, and it was seriously, I mean, yes, some of the worst I've seen,
Mhm.
caring for patients, and one where you just had to detach yourself emotionally from what was in front of you so you could get the job done. And then you could have your, little emotional meltdown or crisis or whatever. But it was also one that taught me so much about working with others and the team. You just had to do it as a team. I remember one of the first flights, the pilot was like, okay, all eyes out the window. And I'm like, I'm doing CPR in the back here. I can't like stop CPR and look out the window until I really understood what I learned in training is that the takeoff and landing are the most critical phases of flight. And so if we miss some wires and, the helicopter goes down, everybody dies. Right. So yeah, it was just learning
Wow.
different, ways to work with a team and because you got to in those situations, right?
You know what? That's amazing. And you talk about you said so much in that little time, right? All eyes out the window, and you're thinking from your standpoint, I'm here to save this patient. But in that moment, he was the leader. He was saying, if we, like you said, we clip a wire, we're all dead. So while we're
Yeah.
trying to save this patient lives, we have 3 live lives on this plane right now that are
Yeah.
alive, and we want to keep them
Hmm.
that way. Then we get back to the patient as we move through them, as we move through the process. So you have doctor in front of your name. What is that? Talk to us about it for the people who can't see the acronyms behind your name. What are they?
So, Doctor of Nursing Practice, and then Masters of Science in Nursing, and then Registered Nurse. I got to tell you the little story about why I even uh, earned those degrees. I started
Yes.
out as an LPN back in 1979. And I worked a long time. And then it was time for me to get my associate's degree and my RN. And there was always a reason why I advanced my career with my education because I raised kids. I have 7 kids. So,
Wow.
working full time and raising a family and then adding school onto that. But I knew that it was necessary for what I wanted to contribute. So when I left the world of helicopters and flight nursing, I had my bachelor's degree, but I really wanted to teach in the classroom. So I started out teaching clinicals and in the sim lab, but I wanted to be in the classroom. So then I got my master's degree. And then there were students that shared, just their frustrations with the director of the program at the time who students felt like didn't make a, a decision that was beneficial to the student or that was, set them back. For the example I'll give you is we had a student from the Philippines whose grandmother died, and he asked if he could take the final exam early, and he wasn't allowed to. And it may have been policy, I understand that,
Yeah.
but he ended up having to repeat the whole term, which, to me was just kind of heartbreaking. And I said under my
Yeah.
breath, well, I'm going to be the boss one day. So to make the right decisions and to do what's right for the students. So I guess if I'm going to do that, I better get my doctorate finished.
Wow. And that was a leadership decision in that moment, because what you saw was a leader who many looked up to, not taking to considerations real life scenarios and real
Right.
life issues. And I think as leaders, we have to do that when we're making decisions. We need to evaluate in the reality.
Yeah.
There's a policy and a procedure for things, but that's in a gray space. What is the reality of the situation? And to your point, once you got into that role, as I mentioned, overseeing 2,700 students, did you lead by that? By that, did that kind of shape how you led?
Yeah, absolutely. There's a quote that goes something like, doing the hard thing isn't always, how does it go? Doing the hard thing isn't easy. No, I
Mm,
can't. We'll edit that out. um, Doing the right thing isn't easy all the time, but I think
yes.
the right thing, just in the term right thing, is always the best thing. Sometimes the
Yeah.
students didn't see that, but I always tried to put the shoe on the other foot if it were me in that situation. I remember, oh my goodness, the first, when I was dean, the first term when I was promoted to the dean position, I had 13 students out my front door of my office wanting to meet with me. And all 13 of them had not passed the course by a 0.5%. And so,
Wow. Been there. Been there.
yeah. And it was tough, but I knew that they were on the edge. And once I made the decision to trim the policy, so to speak, for one or 13, it wouldn't stop. And so that was a hard one, but I have to say that many of those students came back later and said, I wasn't quite ready. And going through the
Yeah.
course the second time, I rocked it and I'm ready. And that made me feel like that's the kind of nurses we want to put out into healthcare, is ones that are ready, not sliding by, just barely making it, because that's when patient harm is going to happen.
And is that what led you, right? You were a leader in the academic situation. Is that what led you to become the patient safety expert that you are today? Or was there other things that contribute to that?
That's a good question. I can trace it back probably to when my parents had their airplane accident. I had just moved across the country. They were living in Spokane, Washington. I had 5 kids at the time, and my youngest was a 4-month-old baby. And my parents crashed their airplane. They were
Wow.
treetop level. They had just fueled on their way home. And so, they both had critical injuries. And this was, like I said, back in 1988. And back then, you couldn't go and stay in the ICU, or I knew that this was going to be a long healing process. Plus, I was the sole breadwinner, working full time. And what was I going to do with the children? So I had to pray that those nurses would take care of my mom and dad like I would. And so that was my first kind of experience, being on the other side of, I wasn't the nurse, I was the family now. And, feeling like calling in for updates. How's mom doing? Because she ended up obviously intubated, and then she failed
Wow.
extubation because they didn't know that she had her diaphragm was lacerated. So she had to be back on the ventilator till that healed. And it's just agony for the family waiting for updates. And sometimes when we didn't get very nice nurses that weren't very patient, it was like, what am I supposed to do? I'm in Florida and you're in Oregon State. So that was probably the beginning of it. And then when I started my master's thesis, and I chose the topic failure to rescue, I even
What
as
is,
a
what hold on.
nurse,
What is failure to rescue?
failure to rescue, thank you for asking. It is in the literature, so I didn't make it up. But it's failing to recognize the signs and symptoms, and they're all physiological, observable signs and symptoms of patients deteriorating. So there's 3 phases basically, or 3 sections of it. It's failure to recognize, failure to act, and failure to communicate. So with medical error, preventable medical error being the third leading cause of death in this country, right behind heart disease and cancer, then we have medical error. I just knew that there had to be something more that we can do as healthcare. And a lot of people are busy. As we know, healthcare is so broad and there's so many niches and specialties. And this just kind of fell to me. And back then, doing my master's research, I thought, why isn't this in the nursing textbooks? Why aren't we teaching this in the curriculum? And it still
Yeah.
isn't. So
Yeah.
about 3 months ago, I thought, okay, Julie, it's time for you to do it.
Wow. just just your content of it's still not in the textbooks, and I don't think I've shared this publicly, and I've toyed on doing a spin-off podcast just on it. Both my parents at some point had COVID, but my dad caught it twice, and the second time it almost took him out. And
Mm,
this is, of course, during COVID, and this is at the height of COVID when we don't know anything about it. This is in 2020 in November, and I remember him, catching it a second time and feeling as if he was like, "I'm just going to take a nap." And I am a nurse. I don't work as a nurse, and at that time I wasn't working as a nurse. I was working as a CEO. I went over to his house and I COVID tested him myself. And I checked his SpO2 because in a past life I used to be a home care nurse, so I had everything with me. I checked his SpO2, his oxygen levels within his blood, and it read 82.
ooh,
Yeah, he at home.
yikes.
He was gonna go to sleep and not wake back up.
Yeah.
So
Oh,
I said, look, you
wow.
need to go to the ER. So I'm gonna call 911 and you tell them no, but you're not gonna tell me no. We're gonna get EMS here. I read the report to him, and I remember 911. So you testing me's positive for COVID? How'd you know? But anyway, I did that. He goes there. They say, look, you're bad. You're not too bad. We're going to send you home with O2, 6 liters, and you can ride this out. I got on that phone, and you better believe I ripped into him. I said, you're not going to send this man home with 6 liters. That would be the last time he goes home.
Yeah.
Sure enough, 2 hours later, they call me back and say, yeah, we just intubated him, meaning we put
Mm,
him on a ventilator.
yeah.
He agreed to go on a ventilator, and this is what's going on. Now, this isn't my podcast. This is the podcast on you, but I'll let you know he stayed on that ventilator for 3 months before we were finally able to take him off that ventilator. He's still alive today. Oh,
Wow.
long story. But we talk about failure to rescue.
Mm-hmm.
When you're talking about healthcare providers not looking at the signs and symptoms and not communicating effectively, this is somebody who, once they put him on a ventilator, he stayed there for 3 months.
Wow.
Yeah. Couldn't excavate him,
Well,
couldn't bring him out.
wow. It is being vigilant and using the clinical reasoning to anticipate and to see the subtle signs before cardiac arrest. Only 17% of patients in the hospital survive to discharge if they suffer cardiac arrest. Most of what happens in the hospital is not sudden cardiac death. That's a rare thing, like an R on T phenomenon, and they go into VTAC. That's rare. Most of the time, it's we fail to recognize. And respiratory rate is the number one sensitive and earliest indicator of patient deterioration. And yet, 80% of nurses do not count respiratory rate. I think the other
You,
18%
you mean
fib.
it's not 16? It's not
Correct.
resident in the room
Yeah,
resting with his eyes closed. Respiratory rate
exactly.
16. So
Yeah.
talk to us, right? Because as a leader, you're educating the next generation of students. You're educating the next generation of nurses. And what you just mentioned is that respiratory rate is one of the earliest signs of a patient deteriorating. Is that correct?
Correct. Mm-hmm. And you think about it at the cellular level, that's where the oxygen exchange happens. And, these lovely chemoreceptors and baroreceptors will tell the body, hey, you need to breathe faster because we're not getting enough oxygen here at the base level. So, yes, as a leader, I decided that, yes, even running the campus or being a dean, that I felt it was so important that the students got this
Mm-hmm.
hour lecture, and I gave it probably to over 10,000 students over, that since I started really in nursing
Yes.
education. And, I have to tell you that I had students reach out to me after they graduated and said, what you taught me in that shouldn't be last, but the last course, and I helped save a patient's life today because of what you taught me. And that, if I've done that for one person,
Yeah.
then that was a life worth living. But I want it to be hundreds of thousands of patients that we end up.
Yeah. And you said hundreds of thousands, right? And I think you're on a mission as the patient safety expert to save how many patients' lives? What is your mission?
We'll go up to 1 million, but yeah. Yeah.
And you're doing that, right? You're a published author, surviving your hospital stay, where you're sharing the secrets to surviving your hospital stay.
Yeah. Patience, I think, to start with. If I could give you one tip or one key as a patient, because everybody is going to be a patient or a family member of a patient at some point in your life, if you haven't already, right? So this really
Yeah.
applies to everybody. But knowing that you have rights, the Patient Bill of Rights was 1978, put in federal law. And it says you have the right to understand the information that is shared with you. And so I think,
Hey, did you hit that like button yet? That subscribe button yet? Well, if you didn't hit it, that's how I get views. I need the views. Sound Leadership with DJ invites you to like and subscribe to us on your favorite podcast platform. If you haven't, hit that bell, hit that subscribe button so you'll be notified of every single episode that we host here on Sound Leadership with DJ. Have you done it yet? All right, now back to this episode.
empowering patients, the first part is just understanding that you have rights and then learning how to speak with the healthcare team. It's not cowering in the corner like a mouse because you don't know what to say. We can help you with that. And that's what I want to do, is help patients and their family learn what kinds of questions to ask. And you have to ask, because if you don't, that's where harm can occur. Let's just say the nurse is giving a medication to your dad. Well, what are you giving my dad? Oh, we're giving him a blood thinner. Oh, did you know he takes one at home already for his atrial fibrillation? Oh, no, I didn't know that. That could prevent a double dose of blood thinners, that type of thing.
That's amazing that you've kind of compiled that and want to teach people how to speak to healthcare providers, because I think as healthcare providers, something that we're not really taught, but we yell out loud to the rooftops, is you have to talk in layman's terms. But when you get into these nursing programs, you're so deprogrammed to talk more as a nurse, as a healthcare provider, to be professional, that you sometimes forget that you have to break it down in layman's terms for that patient or that patient's family, as you've mentioned, right?
Yeah.
As a nurse, we have to assess the patient's level of understanding. And to me, that's a form of leadership as well. I remember as a home care nurse, past life, I would go into a patient home and train a new nurse, and I'll say, ask them about whatever disease process. And this is something that always stood out to me. I was an LPN training a brand new RN into home care, and she went into this patient house and said, "Hey, the doctor says you got diabetes, and are you doing this or that and that?" And the patient said, "I ain't got no diabetes." I mean, the whole family's in uproar. And I said, "Well, hold on, let me speak from this perspective." And I said, "Have the doctor talked to you about having the sugars?"
Mm.
And he said, "Oh yeah, I got the sugars," right? And he went into, my medication is here and this is what's going on. So we have to break it down into the way that the patient understands it. And that once we do that, we can start to properly care for our patient and treat them. I believe. I don't know if that's your same thought perception, but that's my perception.
Yeah, absolutely. An example I can share, almost the same situation. I was helping doing legal nurse consulting for an attorney in this case. This woman fell. She was taken to the quick care, and it was a rural place, so not a big hospital close by. When the nurse on admission into this little quick care said, "What medications are you taking?" She says, "I take a heart pill and maybe one other." Well, her heart pill was a blood thinner. And so they didn't do a head CT, but the patient, when she took a fall, immediately had this big black eye. I saw the picture and I was like, oh my goodness. Anyway, sad story, but 6 hours later, she was dead because she was sent home without the proper diagnostics tools just to rule out, especially with mechanism of injury. It's like, oh my goodness. I told the attorney, I said, I really believe my students could look at that black eye and say, ooh, if there's a bleeding immediately there, there's probably bleeding in the brain. And there was, unfortunately. But yeah, so we need to educate them to the point where we explain those really important things. This is a pill for your heart, but it's a blood thinner, which would include watch for bleeding, etc. And it's our job as healthcare providers in that communication process.
So let me ask you a point blank question. What is leadership?
Leadership is influence. Leadership is not a title. It is a title, but I think it's a fallback. To me, you have to earn that title by how you lead. So I'll give you an example. When I was promoted to campus president in a school in Virginia, I hired a dean, and I had told the team when I first got there, I said, yes, I have a different title than you, but we're all here serving the students. Your student affairs and your registration and your, faculty member. And so I just said, please call me Julie. But in front of the students, yes, please call me Dr. Siemers. And so the dean that I hired when she came in, she insisted on being called doctor. And it was only 2 days, but I could see the faces of our team members, our faculty and our support staff. And I could just see the looks on their faces of like, you think you're better than me, type of thing. And so I had to sit down with her. And that, again, I think what I learned in leadership is early explaining the situation. And I said, would you like to be inclusive on this team? And when I explained it to her that way, I said, when you insist that the faculty call you doctor, it's really creating a divide. And she goes, oh, I didn't realize that. I don't want that. So then she let them call her Kathy. And it really changed the dynamics of the team because we're all trying to have the same outcomes of educating students the best we can to create great nurses. So yeah, leadership is, if they don't follow you, then everything you're doing in trying to move the needle, whatever metrics, whether it's NCLEX pass rates or student satisfaction scores or whatever, it's all in vain if they're not, if they haven't bought into where you're taking them as a leader.
So how do you get their buy-in? Obviously, you've talked about, not setting a division where you are above them, but I'm sure it's more than just saying, hey, we're equal counterpart. How do you get people to follow you? Or as you described it, how do you properly influence people to follow you?
Great book I read, Servant Leadership. And so I had read it before I came to that campus, and they welcomed me with this huge lunch buffet, and they wanted me to go first. And I insisted I go last. And so I think, and there was never anything I would ask my team to do that I wouldn't do myself. So if I said to a faculty member, if I have a faculty call in sick and you're sitting in your office just working on your, next class, I would hope that you would pop in and offer to teach the class or at least substitute, even if you don't know let's say you're teaching a anatomy and physiology class and you still know more than the students. But I would lead by example and I would go into the classrooms and I would teach because I always thought there was something that I could help the students with, even if it's, how was your clinical this week? Talk to me about what happened and then bring in teaching points. So it's just lead by example. I say boots on the ground is the best form of leadership because you know exactly what's going on when you're there and you're present and you're available, meaning in between meetings, I would open my door. Students would walk by. Can I talk to you for a minute? I said, I have about 10 minutes before my next meeting, but yeah, or faculty. And if you're not present and tuned in, you're going to miss a lot of really what's going on. You can't, it's that ivory tower. You can't lead from up here. It's got to be eye to eye.
And, for me, that's one of the things I identify, right? I will get in the trenches. I'm not afraid to get in the trenches and move away from my ivory tower. One of the things that I think people have always said about me is that they love the fact when they come into my office, I will stop what I'm doing and turn around and give them that time and attention. Because I don't believe when we talk about communication and people feeling respected and honored in the workplace, I don't believe that I can make them feel that way if they're talking to me and I'm typing. They're
Right.
talking to me and I'm trying to balance the phone on this ear. And, I don't believe that they feel valued. And to me, that all goes into communication. And I think communication is sent multiple ways, right? It's more than just what we hear. It's what we see and what we observe. And it sounds like what you are communicating to your team is how to lead, how to be inclusive, and how to, embrace, the students, right? Because they're so impressionable. And if
Oh,
they see
yes.
their leaders, disheveled or not supporting them, it's not going to be the best outcome for them. And I have, I've talked about it a million times. I was in eighth grade. My eighth grade teacher, Longfellow Middle School, will never say her name, told me by the time I was 18, I would be dead or in somebody's penitentiary. And I looked up to her. I looked up. So look how impressionable. I'm 35. I'm talking about something that happened when I was 12. Right.
Yeah.
So, but that shows the weight that teachers have on students. So kudos to you for leading your team. Kudos for you for, being that teacher that every student wants, somebody who's approachable and will help them through the situations and really just be a shoulder when needed. So kudos to you. I'd like to thank you for that. If nobody else
Thank
doing it,
you.
I'm thanking you for it.
I certainly made my mistakes, but I always had good intentions and I wanted to learn. I wanted to become better. So I think that desire creates your trajectory of the course that you end up taking, decisions that you make that are going to either um, endear you with your team or, create a distance. So,
You mentioned that you have made your mistakes. And I think what's interesting is when we talk about making mistakes, people don't realize leaders make mistakes. Sometimes they hold us in the highest regard, but we make a mistake. I know I make a mistake all the time. It's no secret. I am full of mistakes. I am still learning life. But
yeah.
is there a time that stands out for you where you've made a leadership mistake? And how did you walk it back or fix it?
So the director of admissions that I hired at another campus he wasn't performing like he interviewed. And it was difficult because I'm kind of, I guess my style is let's get her done, let's go. And I had to learn patience in letting him figure out his way of how he was going to make this job work because he had 3 team members under him. And I really learned a lot of patience because I ended up frustrating him with my urgency. But I think in my nursing career, that's always kind of how I've operated. Come on, let's go. Let's get her done. Maybe that's the flight nurse. I don't know. But I had to really pause and allow him to bring his gifts that I did see in the interview and him become comfortable to I had to support him and he had to feel supported to be able to flourish in that new role.
That's interesting because I had a boss. I was a team leader. They gave me a flashlight and a whistle when I was 18. It told me to blow it anytime there was something going on. So I had my flashlight and the whistle, and I used to blow it all the time. And my boss came to me. Her name was Heidi, back in Michigan, and said, "You're great at leading, but you're more accusatory than
Mm.
quizzical, and I need you to be
Mm.
quizzical." And I said, "I don't. What do you mean? This is not a game show. What are you talking about? I want to know why they didn't get it done and what they're gonna do about it." She said, "But you can ask that in a different way." Just like you asked, why didn't they get it done? Like an accusative, hey, so talk to me about the barriers that prevented you from getting this task done. She said, you were getting the same result, but how you're presenting the question doesn't have people on edge or on guard.
So true.
I
Yeah.
had to learn that.
Yeah. That your energy, your vibe, if you want to call it that, your intention is physical. I mean, it is perceived. So even though I may go in and say it in a way I think it's going to be received well, if it's not here, it's not going to match. I mean, the heart and the head have to match. That's what I've learned. So I need to take a pause and say, what is the intention that I really want? What is the outcome I want? Maybe it doesn't have to be done the way I think it's best, but having that latitude to say other people have good ideas too.
And it's learning to, like you said, let your team flourish. You've hired them for a reason, so you got to let them do the job. There's nothing worse than, as they call it, a micromanager who is just standing there over your shoulder, virtually or in person, and really saying, this isn't right, this isn't right. Because what is that doing to their self-esteem? What is that doing to their
Yeah.
perception of you? And once that perception of you is tainted, it's hard to untaint that perception. So I think that, as leaders, we have to be mindful of how we're saying things and how we're delivering it to our team members. And I'll often self-reflect and I'll ask my team, hey, how are things going? How are you receiving my message? I always end every conversation with any questions, comments, or concern. My team know that because I want to be able to handle that. So it's not done in malice. If I gave you a task and it wasn't clear, let's talk about it. I'd rather you do
Yeah.
that than the day is due say, it wasn't clear, so I just didn't do anything. But that's a skill I had to learn over time.
Yeah.
So let's talk to inspiring leaders. Let's talk to the leaders who want to be you. What advice would you give to aspiring healthcare leaders who are wanting to enter into healthcare or just leadership in general? Because you have years of experience. As we say now, you're the patient safety expert, but you weren't always the patient safety expert. We've
Right.
talked about the mistakes that you made to get you to this leadership ivory tower, as we will call it. But for somebody starting out, what advice do you have for them?
I would say the first thing is to figure out your why. Start with why. Simon Sinek's my favorite, book and TED TED Talk or whatever. But that's really what you got to start with. If you want to lead, to make an impact, and to make things better in your world or this world, then that is going to lead you to make the right decisions, I believe, to have a positive um, influence because of your intention going in there. If you want to be a leader to boss people around, or if you want to be a leader to make a lot of money, those things aren't going to get you there because the intention is always, even if we don't see it or speak it, it's felt. Vibrations and energy is real. Not to get woo woo, but it is real. Sometimes when someone walks in a room and you're like, I don't know what it is, either, oh my gosh, they just like radiate, or, I'm going to back myself up against the wall. And so I think intention is huge. And then how can you support people to come with you? And then you've got to create leaders behind you too. So how do you grow and develop the team around you? I believe in the abundance mentality, not scarcity mentality. There is plenty of good to go around. And I think I've just learned, if I live from that framework, that there is enough. And if somebody got promoted and I didn't, it's not the end of the world.
Yeah.
I always try to think, okay, what is it that I could do to improve my chances of landing the job next time? Or what can I do to stand out to be, I really want her on my team. What can I contribute and give?
You know, you said several things there, and one of the things that kind of stuck out is the mentality that there's enough for all of us here. And I think sometimes people see their coworkers or their friends getting a promotion before them, and they think, oh, what am I doing wrong? And they go to bury their head in the sand. but you can't bury your head in the sand. I think what's important is to find out how to continuously evaluate yourself and grow. So as a leader, how do you continuously self-evaluate to make sure you're the leader that you would want to work for?
So I had a coach. The university provided a coach when I was the new campus president back in Virginia in 2018, and she was amazing. That was so helpful for me because what she did was had me send a 360 survey to the faculty that worked for me when I was dean. And it was really interesting. Some of the comments
I've
were,
done one.
wow, I didn't realize that. But then there were some really funny ones too. Like
Yeah.
somebody called me a solutionizer. I said, you made that word up, but I like it. And you have to be in a mindset that you can take that feedback and say, if he perceives me as maybe unfeeling or only business,
Yeah.
and that I don't have a heart or whatever it may be, you have to be open enough to say, if that's how he feels, then it's real.
Yeah.
Just because I don't see it that way doesn't mean it isn't
Your
his
perception is
reality.
reality.
Exactly, for sure. Yeah.
I did the same thing, and I don't know how far you took it, but I took it to the extent of everybody who was currently working for me, people who I've went to school with, people I've worked with in the past, and I got some 100 responses from people
Wow.
who done me wrong, people I've done wrong, and it was very much spot on. And it was some people where you can always tell who they are, but even the people who had a certain perception of me said the same compelling characteristics. So even if they didn't like that, they thought it was necessary for me to be a leader. And it's no secret. I've wrote a blog about it. I share it. One of the things I had to learn was to be more personable.
Mm-hmm.
I don't raise my voice. I don't do any of that. But as my wife always says, and with the research stated, or 360 said, I do this thing where I lower my tone and I'm disappointed. So,
Oh, that's
and I think it's
interesting.
because everybody says I'm always so happy and jolly, but then I'm like, so you thought that was the best thing to do? Like, really? Like, I didn't raise my voice, but I'm no longer happy and jolly. So I had to learn how to kind of balance that because sometimes I am disappointed, but I have to show it a different way, or my body language. My wife always say, no, you will say things are going well, but your face,
You
it's
can
not
tell.
agreeing. And I had to learn. And a part of that is I hadn't had the experience, right? I became a CEO at, I think, 25 of a healthcare
Wow.
organization. I mean, I had the business skills, but what I lacked was the soft skills.
Yeah.
The soft skills of leadership. And that's something that, if I'm being frank, is not always taught in school. I mean, I have a master's in nursing and a master's in business. And nursing, you're patient centered, but that's not dealing with coworkers. That's how you treat
Right.
patients, and they're
Right.
two different populations.
Mm-hmm.
So,
Yeah, that is so true.
how do you hone your soft skills? Like you said, your 360 assessment kind of yielded some results, and some I'm sure you was like, okay, that's me, spot on, and some you was like, what'd you say, a solutionizer? I don't know if
Yeah.
that's good or bad, but
I think taking the time to do that and reflect on a regular basis and checking in with your team. I met with my leaders every week for an hour, each one of them. I know we had our team meetings, of course, and you have to build the rapport that somebody would feel safe to tell you, you were a little brusque this morning and I had a rough morning and it didn't make my day go very well. And I'd be like, oh, I'm so sorry. I knew we had campus visitors coming and I needed to get things cleaned up. And I apologize, that I didn't take the time to recognize that you had a rough morning. But you have to build that trust, with your team and have that back and forth.
I love it. And I love being able to banter with people back and forth about leadership. And one of the things that we're doing in Sound Leadership with DJ Season 3 is we have these questions that really are off the cuff questions. And, if anybody's watched Season 1 or 2, those questions aren't in there. But I'm going to ask this one. You get your choice to sit down with 3 leaders and have dinner. Who are they and why?
My hero has always been Princess Diana. And I
I
say that
love it.
because she was the epitome of care.
I love it.
She just had, no matter her status, that love for
Yes.
a human being, no matter the skin color, the age, the whatever. She just had that purity of heart that I thought, that's what I want to emulate from my heart.
Yes. So that's one. You got 2 more.
I got 2 more. Oh, Nelson Mandela, of course. I mean, he's probably on everybody's list.
This is a table. This is a
How did
table.
he maintain his peace for
Yes.
so long in what he endured is just like an ethereal being to me, right?
Yeah.
I would love to learn. Yeah. And then I know these are iconic figures, but Martin Luther King, man, I'm telling you,
I said that.
his,
He was at my table.
oh my gosh, his dream. How did he find the courage in his day and age of raising the awareness and blaring the horns and whatever else he did to really disrupt? What
But
gave
isn't
him
that
the
what
courage?
leadership is?
Yeah.
Disrupting the status quo. You name 3 powerful people who disrupt the status quo and didn't
Mhm.
take no for an answer. As nice as they all are, were disrupt the
Yep.
status quo. I've captured that from you. Your experience in which you've talked about, you've disrupted the status quo. You've become a patient safety expert, and then you channeled that into a business. So it's no wonder you have those key people at your table. If I'm looking at who's at your table, it's a reflection of you.
Well, thank you. You know, I really feel like what I'm going to talk about on the TEDx stage, as soon as I get the location, what I talk about in my LinkedIn posts, what I talk about on TikTok or whatever, it's not to disparage the profession or throw nurses under the bus or healthcare or whatever. It is to raise the awareness of a healing, compassionate profession. I feel like we need to get back to the heart. And so one of the TEDx applications actually said, if you have a controversial topic, what are your thoughts on how you would manage, you know, that that landing on someone? And I said, what I say may land on some healthcare professionals as critical or, you know, pessimistic or whatever. And it isn't. It's just statistic. It's just data. Um, but my goal, my ambition, my mission is to bridge between the gaps we have of patients and healthcare and create that bridge where patients do feel safe to ask questions and know that it's in their best interest. And for doctors and nurses not to say, I got to go and can't answer questions. It's to really, like I said earlier, put the shoe on the other foot. Dr. Jones, if that was your mother in the bed and not mine, would you be doing the same? And really make it, it's got to get back to humanity in the heart. I think we've just kind of gotten away from that. So I think it will be disruptive. But I also think, I hope that it gives people the courage to say, yes, we have to do this. We've got to make a change. It hasn't changed really in several decades after, in 1999, To Err is Human came out. You know, we haven't really made a whole lot of progress. So it's time.
Well, Dr. Simmers, I have loved this conversation. And, you left us on a cliffhanger, which means we're going to have to go. We're going to have to record a second episode. But how can people reach you? You have a website, or you mentioned something about a TikTok. Talk to us about you, your business, your website, your TikTok.
Yeah, thank you. So the book is on Amazon. My website is Dr. Julie Siemers, Dr. and then Julie, Siemers. .com, and I have education courses that I'm packaging for nurses who already have their license, so hospital-based probably, but anywhere, that really can provide the fundamentals of education that may have been missed. We know during the pandemic, a lot of students didn't get hands-on experience. And I really believe that there's a lot of gaps in nursing knowledge that is contributing to harm with patients. There was a study done in 2021. It was over 5,000 licensed novice nurses, over 26 states and 141 different schools. And that 5-hour exam that was both hands-on and written, so application of knowledge, simulation lab, et cetera, less than 10% of those nurses were competent and considered safe for practice. So I think we have a big knowledge gap to enhance. So that's a part of it. And then the other is on the socials. I'm just trying to provide tips and tricks for families like I do in the book, and stories. Unfortunately, the stories in the book are true, but there's over 30 stories. And many patients can relate to those stories and hopefully say, okay, if my husband was in this situation, I know now what I could do to prevent, poor outcomes. So I know that's a lot, but I need to live another 100 years.
Listen, here's the deal. You're out here saving patient lives and improving quality care that patients receive. And like you mentioned earlier, one day I'll be a patient. You'll be a patient. And we want to look up and notice that healthcare provider is competent and is considering our needs individually and really investigating what our families tell them, because our families may not be able to speak at that high level of understanding. So they need to be, as a provider, able to come down to the levels that my, daughter may be, right? I may pass out and my daughter's the only one there, but she knows I have a breathing problem. They need to investigate that as, okay, this guy potentially has asthma or whatever it is.
Right.
So thank you for being on that mission to save over 10,000 patient lives. Give us your social. How did they find you on the social? How did they reach you? I think you said your website is that those are the best places to reach you.
Yeah, and on the bottom of the website, I think is my link tree, which links to the YouTubes and the LinkedIn articles. And I think what else is there? TikTok and then Instagram and Facebook.
Listen,
so just trying to cast a wide net.
If they're not following you, they need to follow you. And her information, Dr. Julie Siemers' information, will be in the bio of this podcast episode. Thank you, doctor, for coming on. I really appreciate it.
Thank you so much. I appreciate your audience, and thank you for doing this.
Hey, it is not a problem. I want to thank Dr. Julie Siemers for coming on, and thank you for everyone else who've embarked on this leadership journey with me here at Sound Leadership with DJ. If today's episode has been a journey filled with insights, inspiration, and wisdom, if today's conversation sparked a new ideal, inspired action, or simply left you wanting more, we invite you to connect with us. Explore more of our work by following us on YouTube and LinkedIn at Sound Leadership with DJ, as well as liking us on all your favorite podcast platforms. Don't let the journey stop there. Hit that like and share button now. As we part ways today, remember, leadership is a journey, not a destination. Keep striving to learn and grow and never give up on your goals. We're honored to be a part of your leadership voyage and encourage you. Run it back. As we part ways today, remember, leadership is a journey, not a destination. Keep striving to learn and grow and never give up on your goals. We're honored to be a part of your leadership voyage and eagerly anticipate welcoming you back for more enriching dialogues and transformative insights. Until next time, keep leading, keep growing, and remember, within Sound Leadership with DJ, you're always in good company.
Thanks for tuning into Sound Leadership with DJ. If you like this episode, be sure to subscribe to the show on your favorite podcast platform. Share your favorite takeaways with a friend or colleague. Leave a review and let us know what you think. And remember, leadership is not just a title, it's a choice. Choose to lead with purpose, passion, and impact. See you on the next episode.